Okay, good afternoon, everyone. Welcome to our webinar on strategies for success in CaRMS. We're delighted to have you all here today, whether you are a newcomer navigating the Canadian healthcare system or a seasoned professional looking to offer some guidance. This webinar promises to offer valuable insights and strategies. We have an excellent lineup of facilitators, Nida, Fatima, and Randa, Yosef, who will share their expertise and lived experiences to help you succeed in the Canadian residence matching system or process. Your moderators are Dwight, the IEHP Mentorship Coordinator at Pegasus, and Saida Fatima, IEHP Project Coordinator at Pegasus. The proceeding is brought to you by Pegasus Institute with the kind support of the Canadian Medical Foundation. Without further ado, let's start with the land acknowledgement. We acknowledge the land we are meeting on is the traditional territory of many nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also recognize that Toronto is covered by Treaty 13, signed with the Mississauga of the Credit, and the William Treaties, signed with multiple Mississauga and Chippewa bands. As we gather, we pay respect to their elders, past and present, and acknowledge their enduring presence on this land. Before we begin, let's take a quick look at today's agenda. We have an exciting lineup of activities planned, including our web launch, presentation from our expert speakers, interactive Q&A session, and insightful discussions. Our spotlight activity today, of course, will focus on sharing success stories and practical tips for navigating the CaRMS process. Get ready for an engaging and informative session. At this time, I will now hand over to Saida, who will be taking you through our engagement activity.
Hi, everyone. Good morning. So this is Saida here, and I'm an IEHP myself. I finished my medical graduation in India, currently doing my MBA here, and also working with Pegasus. I'm doing my MBA at University of Waterloo. So this is a very casual, although it's a medical case. It's a very casual icebreaker session. So we are just going to go through a couple of medical cases, something very similar to the QU1 or the QU1 question. So I'll read out the questions and you'll have a poll and you can answer through the poll and see how we can navigate from there. So the first case is traveler's turmoil. A 38-year-old male presents with intermittent fever, severe headaches, and a rash on his lower extremities. He recently returned from a hiking trip in South America. And the second case is gardener's gripe. So a 47-year-old female avid gardener complains of shortness of breath, fatigue, and a persistent dry cough that has worsened over the past 3 months. I'll launch the poll and please feel free to answer based on your experience as well. And, sometimes also from your personal experience if you're not into the medical field. For the first question, like I mentioned, it was quite straightforward. So the answer is dengue fever. So the main clue here is the recent travel to South America, which is prone to the particular epidemic. And also, there were other options. For example, we also had, I believe, I'm sorry, I'm just going through the other options that we had. Yeah, the other options were malaria and typhoid fever. The malaria will also have a cyclical fever, which is not mentioned here. And also in typhoid fever, you will have additional gastrointestinal symptoms. I'm sorry if I'm using a lot of jargon, basically gut issues in the typhoid fever. So absence of those and the recent travel history are the main clues for dengue fever. And then the second question, we saw a 50-50 response. One is for hypersensitivity pneumonitis and also asthma. I understand how this can be confusing. However, with asthma, there will also be a typical symptom of wheeze, which is not mentioned here. And their the main clue here is their occupation or their hobby, where they're more exposed to the organic dust from gardening, which has caused hypersensitivity pneumonitis. So yeah, and I hope you all had a good revision of topics through these questions. So now I'll pass. If you have any questions, please feel free to reach out to us either through email or even through the chat box. We'll be happy to answer. And I I believe now I'll pass the stage on to Mohammed, and he will be talking more about the website.
Uh, okay, so before Mohammed comes on,
Oh, I'm
I'd
so
like
sorry.
to
Yeah, I'm so
invite,
sorry about that.
that's okay. I'd like to invite our Executive Director, Melissa Walling, who would be doing our official welcome. Thank you.
Thanks, Dwight and Saida, and welcome again, everybody. I am the Executive Director of Pegasus Institute, and I'm very happy to be here with you all today. Just going to explain a little bit about Pegasus Institute quickly for those who don't know. So we are a charitable organization that aims to build an effective collaborative network that promotes the interconnection of peace, environmental sustainability, and health for all. So we do this in various ways by engaging in collaborative knowledge exchange, network formation, and research activities that address the interconnections between peace, environmental sustainability, and health. And some of the core activities that we participate in include interactive events, educational activities, publication of information, research, policy, and promoting and sharing ways forward. So a little bit about how the Internationally Educated Healthcare Professional Program got started. So in 2021, Pegasus Institute partnered with the Canadian Medical Foundation to reduce barriers for IEHPs and their with the goal of practicing their professions in Canada. So the project itself is a comprehensive support structure for IEHPs with a focus on refugees as well in their journey to contribute to Canada's health and human resources and to begin to build a life that is socially, culturally, economically satisfactory for themselves and their families. So we're looking to address the unique challenges faced by IEHPs on their path to eligibility for practice in Canada. And that's what we're doing here today through our various means. So there's two main streams of support that we have. We have our online resource platform, internationalhealthprofessionals.ca, that we'll be launching today and talking more about shortly, as well as our mentorship program. So these webinars are a part of our mentorship program. They're interactive. They provide a space to share skills and knowledge directly from people with lived experience and allow people to come on with us and other IHPs to engage and gain some knowledge and skills and share their experiences as well. And in addition to that, we also have a one-on-one mentorship program that will also be explained coming up in this webinar. So thank you all again for being here. We warmly welcome you to our webinar today, to our network, to our mentorship program, and to engage with internationalhealthprofessionals.ca, as well as Pegasus Institute. Thank you.
All right, thank you for that, Melissa, or well-able Executive Director. And at this time, I'll now allow Mohammed to take over. He will be presenting or doing our web launch for us.
Hello, everyone. Nice to have you all in here. For those of you who doesn't know me, my name is Mohammed. I'm an IEH myself, and I am the founder of Paytech. It's an IT consulting company that we're working alongside Pegasus into developing this amazing project and website. So what I will do, like I was told that I only have 6 minutes, so I will just go briefly through the website because we're officially launching the International Health Professionals.ca, and then give the participant 2 minutes just to scroll through the website quickly. So I will be sharing my screen right now. Okay. So this is the main page. Once you go to internationalhealthprofessional.ca, you will be welcomed with the homepage. When we designed the website, we kept three things in mind: simplicity, and accessibility, and inclusiveness. You will on the top, you will see our logo, and you will also see the navigation menu, and then a sliding bar to just show you some information. And then you can select your professions from here with those simple pictures. And then we have a quick call to action section, and then previous webinars recording. And then at the end of every page, you will find a way to contact us by filling your name, email address, and the message with just a simple authentication. And then at the end, we have the sponsor of our information about the sponsor, which is the Canadian Medical Foundation. Special thanks to them for sponsoring this project, make it available to all of the IEHPs. You can click at the link and learn more about their mission and vision. Then scrolling up again into the main menu bar, you will see the About page. If we go to the About, you will see like a lot of our like information about our organization, about our mission, vision, and our dedication to help the IEHPs. And then you will also find links to the Canadian Medical Foundation, the CMF website, and the Pegasus website. And then in the profession, you will have like submenus, and each depending on the profession, and each profession has another submenus. Right now, we're mostly into physicians. We're working on the nurses as well, and we will have more and more health professionals coming soon. So going to the physicians, for example, you will be welcomed with menu regarding this profession. We try to, like for those options, we have to kind of like a hover over information for like for example, a specialty route, who is it for, and for alternates, for who is it for. And then if we feel that we need more information, we are creating pop-ups as well to help explain. So this way we make it simple for you guys, so you don't have to actually just go in deeper and find out. You technically see what it is for before you go inside. So let's go inside the specialty route, for example. You will see another options. And throughout the website, we created maps to simplify things. You will see in them, like when you scroll through the website, a lot of maps, and like some of the maps are like interactive. What I mean by interactive is that the pinpoints are selectable, and once you select them, it will take you to different pages regarding what you selected. And again, like as I said, like on every page at the end, you will have a way to contact us if you need, and also at the top in the contact menu if you need any questions or anything. And then we have in the mentorship page. The mentorship page has some good information about the mentoring and the next mentorship sessions where you can register, and then previous recordings and some other information about the mentorship program. And then also we have the resources. We have plenty of amazing resources organized in here on this page. You will see explanation about each resource, and then you can click more to learn. Click here to learn more about each one. And then we have the events page. In the events, we will be posting the events, past events, and future events as well if we have any recording. And in the discussion is that it's like a forum. You can register by clicking login, and then you register using this. And once you register, you will be able to see the discussions, you reply, you contribute technically to the discussion forum. And then in the terminologies, we have kind of like a like frequent ask questions and things like to simplify terms, and you just click and expand them to learn more. And then we have also the contact page, again, to contact us if you have any questions, and we'll get back to you as soon as possible. So I will stop sharing my screen now. Probably if we have a couple minutes for you guys to just scroll through the website, you can just go to internationalhealthprofessional.ca, and I will write it also in the, it's already actually in the chat. You can just click the link and scroll through the website quickly. And thank you again, all of you for being here. We will be also posting about the launch in our LinkedIn page. Dwight?
Okay. All right. Thank you for that, Mohammed, for taking us through the one-stop shop or IEHP website. Now it's time for, of course, the reason why we're here. And I'd like to take this opportunity to introduce you all to one of our facilitators, Dr. Nida Fatima, an incoming PGY1 resident at Western University. She, of course, specializes in family medicine, and she's a past graduate of the Dow University of Health Sciences in Pakistan. Prior to her residency, she played a pivotal role in the thoracic surgery remote home monitoring team at Western University. Now, their pioneering digital health monitoring program earned them the esteemed Patient Safety Champion Award from London Health Science Hospital. Additionally, she was part of Canada's Maternal and Child Health Initiative, showcasing her commitment to healthcare innovation and patient welfare. Participants, please help me welcome Nida Fatima, who will be facilitating you for the next few minutes.
Thank you so much, Dwight, for introducing me, and thank you so much, Pegasus, for having me here. I would like to share my screen now. So I'm Dr. Nida Fatima, and I will be starting my residency at Western University, and I will be sharing some of the insights or some of the things which helped me in getting matched, which I have learned through like my experiences and through my mentors. So I would like to share those things. So these are the few things which I will be talking about. CANMET roles and QE1 and NAC, also about some clinical and volunteer activities which you can do here in Canada as well as your home country to improve your chances of getting matched, and obviously about the monstrous CaRMS application and interview preparation, and I would be happy to answer all your questions. All right, so I cannot emphasize enough on the CANMET's role. So when I moved to Canada, everybody was talking about that you have to incorporate CANMET roles in your CV, in your preparation, which I do not understand completely. And I'm sure that many of us, in fact, every one of us has worked on these roles, but we just don't know how we can utilize it and how we can incorporate it and show it in our CV. So by showing, I do not mean that you need to use those words like I am a professional, I'm a communicator. No, this is a big no. What we can do is that we need to choose some examples where we can showcase our abilities, that we have been doing all these things in our previous practices, and what we have learned from it, and how we can advocate our patients, and how we can teach medical students, or like those type of examples. There is a very good module at Queen's University website. I think currently it's on hold because of like some renovation or what, but just go to this link whenever it's ready or they have done with their changes, and do this module. It is very helpful to understand that how we can use it. Because CanMed's role you can use not only in your CaRMS application, but it is also important about the ethics part for your QE1 and how you can be answering your NAC OSCE questions. So you will be using a lot of these words and these roles throughout your CaRMS journey, and even while you will be practicing as a physician here. All right, so I will be talking briefly about QE1 and NAC for those who are just starting their journey. So for QE1, if you graduated, more than 3 to 5 years ago, then you might need like 3 to 6 months for QE1 practice. And I need to emphasize that QE1 and NAC scores are extremely important, especially for Ontario. So to get the Ontario invite, you need to score high on either of QE1 or NAC. So QE1, we cannot repeat it. But NAC, you can repeat it if you score low. But I think that with practice, you would be able to score high in NAC. However, QE1 is a bit tricky. And there are some resources which you can use. This might be like, these are the resources which I have used. But I think that there might be some changes now and new things are always coming. So I have used Toronto Notes, Master the Boards, MCC practice tests. So MCC practice tests are extremely important. And these are very closer to how actual exams look. So just do those tests, but make sure that you are taking these exams 1 month or 20 days before the exam, so that you know that how ready and prepared you are for the actual exam. Then you can use UWorld for your base knowledge and Canada QBank. And there is a new QBank called ACE QBank, which I have heard that it's very similar to exam as well. For NAC, you can do like 2 to 3 months of study. For NAC, it is extremely important to have a good study partner with you. Try to practice with the multiple partners as well, but have 1 or 2, main study partners whom you will be practicing daily, at least for 1 to 2 hours. There are some good courses for NAC as well. You can definitely try. You can take the introductory classes, which are free, and you can see that which mentor style you like. So you can choose according to that. And as I have mentioned before, that you need to have either the high score of QE1 or NAC to get the interview from Ontario, because they have put the filter. And if you only belong to the top 300 candidates with the good scores, only then you will be sent the invite. And after that, they review your whole application. For other provinces, it's not like that. I have seen people with the lowest scores getting matched, getting the interview. So they look into your overall application and your CV. But Ontario, they put the filter because because there are more people who apply to Ontario. So they have this cutoff and then they review the file. So yeah, so just spend a lot of time on your QE1 and NAC and research a lot before you start. Also, so these are some of the important things which helped me, because like no one can say for sure that what has helped them the most, because we are only speculating. But these are a couple of things which you can do here in Canada, as well as if you can go back to your home country and do that, then this is good too. So the more recent you are, or the more recent you are in your practice, you will be giving priority for sure for all the provinces. So if you have a gap of more than 2 to 3 years, then I would suggest, if you can find the time and resources, go back to your home country and do at least 2 to 3 months of recency of practice while you will be applying for CaRMS, because this is the best time that you can even take your interviews from back home while you are doing your recency of practice. And you can mention in your interviews that I'm working as a physician here and I'm seeing those cases these days, or whatever you are working on. So The best thing is the best department you can work with is, I know that a lot of countries do not have family medicine, so you can work as a GP, or you can work at a hospital emergency department, or in outpatient clinics. This will be helping a lot, especially if you are seeing multiple population, not only like specifics. So try to work with all types of population, including pediatrics, geriatrics, and women health and child health. The other thing which you can do here in Canada is try to find some clinical assistant jobs. In Ontario, unfortunately, it's not licensed, so it does not have a lot of weightage, but still, it's better than doing like some other work. So try to find clinical assistant jobs. But recently, there are a lot of good opportunities in other provinces. If you can shift there, try to apply for BC, Alberta, there is one more province, Manitoba. Yeah. So what I have seen that a lot of Manitoba clinical assistants who are working there, they all get matched either to CaRMS or to MLP-IMG. So they prefer their own clinical assistants over other candidates because they know for sure that they will be living in the province and they are working towards getting matched to the same province. So try to find clinical assistance job. BC has launched another new category called physician associate, which is another good thing. So if you just check the eligibility criteria, and if you fit for the criteria, just apply there. It's very easy to register with them, and they will be guiding you as well. So whenever there is any position, they will be approaching you to send the required documents. If you have a 2-year or a 3-year PGship, like from your country or any post-graduation, it will be helpful because some of the specialties need 2 years of postgraduate training for the physician associate position. Also try to find observership here if nothing else works. So you can do observerships while you are preparing for the exams because it will not consume as much of your time, but you will still be seeing patients and continuously involved in some clinical activities. The other benefit which you can get from observership is if you are doing observership with a faculty member, it has a lot of weightage because they will be observing you. They will be seeing how good you are in your communication with your patients and with their staff, as well as they sometimes ask you to do the physical examination and they will be assessing you. So if they give you a strong reference letter, it has a lot of weightage, more weightage than any other clinical assistant job you might be doing with a non-faculty physician. So I think this is extremely important if you could try and find some observership with the faculty members. The other thing is research. So research is not as important for family medicine as for other specialties. So if you are targeting towards internal medicine, pediatrics, emergency medicine, then research will be extremely important for you. And it will put a lot of weightage to your application. But for family medicine, it's not as important. However, if you are working in a clinical research, maybe a clinical research trial, or working with the family physician for any of their researches on the topics which we commonly seen in the family physician clinics, so it will be useful for you because you will be having patient interaction as well, and you are working on the topics which are relevant for family medicine. So try to volunteer on research, try to find opportunities. I know it is extremely hard, but what I used to do was I was always trying to email, like cold email to the directors or the persons who are running the researches. So just try to go to the hospital websites wherever you are living and see that who is involved in researches and what current researches they are doing, and then just reach out to them. Most of the time it does work. So they might not ask you to come immediately, but they can tell you that, okay, maybe come in 2 to 3 months, we will be needing your help. for data collection or data analysis or whatever. So that way you can be involved in some great research experience as well. Also, the volunteer option. So a lot of people was asking me that where we can volunteer and how it might help. So I think that volunteering is extremely important, especially if you are working with recognized organization like CMHA, CAMH, and you are helping, you are maybe working in their support line volunteers, and there are like multiple options for volunteers in those websites. So try to apply there. It will take some time for them to register you because they will be checking the background and everything for you. But once you become their volunteer, try to build a rapport with them so that you can get a good reference letter from them whenever it's needed. It has a lot of weightage too. Also, for those of you who are interested in rural medicine or wants to work in rural areas, try to volunteer in rural areas as well. It does not necessarily needs to be clinical. You can volunteer maybe for food banks or any community center. So the basic purpose of rural volunteer is so that you are connecting with the community. You are showing them that you have interest in rural medicine. And then some of the programs, maybe like NOSAM, they ask for community support letters. So it will be useful if you have some connection in rural sites. Also, if you can find any public health job, it is relevant and useful too. And you will be getting some good references and experiences from there too. Okay, now the CaRMS application. This is the biggest monster. Honestly, it drains all your energy. It takes a lot of time and efforts to do CaRMS application. The cycle starts around September, October, but there are a lot of prerequisites as well. So what I suggest, just before starting off the CaRMS application, try to get done with your English language proficiency exams like IELTS, OET, whatever you find easy. Just make sure that you are done with it so that you can concentrate on other exams, because there are some other exams as well. So there are FM Pro C and Casper. FM Pro C is required now for almost all the provinces. It's an ethics exam. You will be taking that exam, and Casper is required for now only for Saskatchewan, but I am guessing that next year it might not be needed because everyone is accepting FM Pro C now. Okay, yeah, the other thing is I need to emphasize on this that I'll put a lot of time on your personal letters. Like you need to shine through your personal letters because maybe Ontario is only looking at your scores when they are sending you the invites, but there are other provinces who actually read your letters and they pick up your shining moments, your shining stories from there. And they even ask you about those stories during the interviews. So just make sure that if you have any unique experiences, maybe you have worked with the Indigenous community, not necessarily in a clinical setting, but you are helping them in any other way, talk about that. If you have some rural experiences, talk about that. If you, like, I'm sure that many of you were practicing before coming here in Canada, and even as a medical student, there might be some moments where you actually advocate for your patients. So think about all those stories. First, write down all of your shining moments and stories, and then use in your personal letters according to the questions, because every province has different questions. So you can, see that which story you want to put where. And then, yeah, letter of references. So as I've mentioned before, that this has a lot of weightage in your CaRMS application. So try to find mentors who are affiliated with universities. This is the letter which came from faculty has the most value and the most weightage. So just try to find someone who works with university. And like I know that a lot of people said that observership letters does not have any weightage, which is wrong. If your observership letter is coming from someone who is faculty, then it has a lot of weightage, more weightage than any other clinical assistant job. But if you have experience and like if you have a letter of reference from back home, which shows your experiences, like maybe you were working as internal medicine over there and you just moved to Canada only 1 year ago and you are not doing any maybe like you just started to work at a clinical assistant position. So your letter from back home will have more weightage than that clinical assistant position. So you can use like mix and match, use one letter from Canada, 2 letters from back home, or if you have 2 very strong observership letters and one usual like normal experience letter, then use 2 observership letters and one your job or work experience letter. So that should be fine. So just know that who can write a strong reference letter for you. Also, like there are a lot of things to put into your CaRMS application. They have multiple tabs. Those of you who have already applied to CaRMS, you must have known that there are a lot of things to fill in your CaRMS CV. If you have any awards, any honors, just write about that. Like you need to boost as much as you can about yourself. I know boosting is not nice, but with CaRMS application, you need to boost. You need to talk about you. Like you need to make yourself shine for them, because that's the only way they can understand that how valuable your work is and how valuable your experience are. And after the CaRMS application, you will be feeling very low, especially if you only get like 1 interview or no interviews at all. Do not be disheartened. Do not lose hope. There is always second round. And in second round, those of you who have like low scores but have excellent other application, like the overall application, you all will be getting the invites and you will match. So just don't be disheartened. And CaRMS is just one aspect of your life. It's not your whole life. So it's extremely important to find other activities out of medicine, out of CaRMS, so that you can have some sanity left.
Okay. Thank you so much, Nida, Fatima, for those wonderful information. Now, at this time, I'm going to ask Saida to just introduce our next facilitator, Randa Yosef. Saida.
Thank you, Dwight, and thank you so much, Nida, for all the very, very helpful tips. I was also taking notes as you were speaking, so thank you so much for that. I'm sure we have more questions as people, like if you have any questions, you can even enter your questions in the chat box, and I'm sure that Nida will be happy to answer. So now we can introduce and welcome Randa. And she is also an incoming family medicine resident at Western University. And she's a specialist in obstetrics and gynecology from Syria. Like many people here, she's also an internationally educated health professional, and she understands the struggles and barriers faced by other international health professionals, and she wants to contribute and help as much as possible. And she has years of experience providing healthcare to patients affected by social determinants of health, poverty, and displacement due to conflicts in both Syria and Turkey. And she also, in addition to her professional endeavors, she also has mentioned that she finds joy in nature walks with family and trying new food. And I think we can all reflect with that, especially with the improving weather. Thank you for joining us, Randa. The floor is yours.
Thank you so much, Saida, for this nice introduction. And I would like to thank Pegasus for inviting me to this amazing webinar. Thank you, Nida, for sharing all your amazing journey with us. It was really inspiring for all attendants today as well. My name is Dr. Randa Yosef, and I am an international medical graduate from Syria. I did my specialty there. I had residency training in obstetrics and gynecology. I worked as a specialist there. Because of the conflict there, I traveled between Turkey and Syria. I had chance to provide the general primary care in some locations because of the lack of physicians there. Then I moved to Canada. When I started the journey in pursuing the physician pathway here. When I came here first, I didn't know anyone. I didn't know how to get into the system in any way. So it took me a while until I was able to understand the system and to figure out the pathway I will go through. And I would like to thank the Pegasus with this initiative of internationally educated healthcare professionals, because when I look into this now, I think if I saw these websites when I came to Canada, maybe that would save me maybe 2 to 3 years of the years I spent here in Canada. So this is an amazing, and I would encourage everyone to look into the website and see what options are there, because it's really full of resources that would be really beneficial for all IMGs. So I don't know, I shared Saida the PowerPoint, so we can start. My PowerPoint presentation, I would say that Nida touched on most of them, but that is not necessarily I would say that is a good thing, because that means we are agreeing on the same things that are important for IMGs when pursuing the CaRMS pathway. So I might skip some of the things she mentioned, and I would like to share some of my personal experience and what I did differently, because I matched in my second year of CaRMS cycle. This was my second year. Last year, it was challenging that I did not match. However, this is the reality with CaRMS. Whatever you do and how much effort you put, there is a chance of not being matched, but the important thing is not giving up. It was challenging for me last year. I took some time off, then I bounced back. I looked thoroughly on my application, and I just tried to figure out what I can improve on, and worked really hard last year to improve my application. So I would like to just share some of the things I try to highlight or improve in my second CaRMS cycle. And to mention that I received only one interview. I applied widely to Canada, all over the provinces, but I had only one interview, which was Ontario. So I matched with only one interview. So it is doable. Like sometimes you don't get discouraged if you received only one interview. It is doable, but it needs a little bit of hard work. So first, point I would like to talk about, also Nida mentioned about the importance of your scores. If you had your exams already, so QE1, you know you cannot change. However, if your NAC score is low, you have the chance to improve your NAC. This is, I know some people say, no, people match with the low exam scores. That's right. Some people match with low exam scores. However, when your exam scores are low, you need to emphasize other parts of your application. So you need to put more effort in other parts of the application, while if your exam scores are high, you also guarantee that they will not drop you from the first screening like Ontario does. Ontario province specifically, they screen with exam scores. It used to be QE1, but this year they said it's NAC. So I would recommend just like aim for good scores in both of them. For the preparation time, myself, I took quite a bit of time for QE1. I studied medicine in Arabic back in Syria. So when I came to Canada, it was really challenging for me to go over medicine in English. It took me more than 2 years to be able to be confident to write the QE1 exam. But I wrote the NAC, but I had a good score in QE1. Then I went right away for NAC. I prepared for NAC around 4 to 5 months, and I had a good score in NAC as well. My scores helped me get interview in Ontario. Other provinces did not invite me. I don't know, some people, they say, year of graduation matters. I'm not sure if that was the reason. I am an old graduate, so I'm not sure if that is something in other provinces. So we can move to the next slide, Nida, if possible. Thank you. So here I would like to talk a little bit about the timeline of CaRMS application. I would recommend all of you who are preparing for next CaRMS cycle to go over the CaRMS website, because there you can find the previous CaRMS cycle and everything is mentioned. Like, so you can familiarize yourself from now about the match, the program description from last year. You might find the timelines. And I would like to emphasize on the timelines because some people might miss important dates because they don't know about them. I have personally a friend who missed to apply to BC province because she missed the date for BC CAP application. So some of you might know about BC CAP application. Some for first time applicants might not know, but BC CAP application, it's basically when you want to apply to BC through CaRMS, you have to go to BC CAP application, which typically opens before CaRMS opens. So now we are, let's say, in May 1st. So BC CAP might open in August, and they will open for 1 month or 1.5 months, and they will close before even the CaRMS open. So if you don't track that time for them and you don't apply there, you won't be able, when CaRMS open, you won't be able to participate in BC through CaRMS. The other province is Alberta. Alberta has specific requirements to be a resident of Alberta for a certain time, and you can find these requirements over the website in Alberta International Medical Graduate. There's the link there. So these two provinces, I would recommend that just familiarize yourself with their timelines because they are different from the CaRMS. So you won't miss the chance to apply there if you are interested. Thank you, and we can go to the next one, Nida. Thank you. So this is again, Nida talked a lot about the CANMED roles, which are really important. As you are preparing from now, please like print out the CANMED roles and put them somewhere where you can see them every day. Take notes of each one of those roles. Because those are in the Canadian healthcare system, these are the qualities that makes the good family physician or physician in general. Like we as physicians coming to Canada, we might did all these roles, as Nida also touched on that, but we might not able to emphasize what we did. So just take some time every day or every week, look into them and just write them down. Because they will be really helpful when you start preparing your application, when you start writing your personal statement, when you start writing your CV, even in your interview, because it's all about the CANMED roles. So I would emphasize again about the importance of those. Please keep them somewhere you can see them every day and spend some time every day just to write down, like, when was the time you led a team? When was the time you advocated for patient? For the scholar part is very important as well. It has two major categories, which are teaching or educator and research. So also if you taught medical students or any experience of teaching, you put it in there. Just put a notebook like for all the roles you had that demonstrates the CANMED role. Then you will find them very handy when you start preparing your application. There is an emerging, this CANMED roles framework was established in 2015, but now they are studying to, because the concepts are emerging, so they have a new concepts coming up. I put those there because they will be coming up in 2025. So maybe you would like to have a look, what are the expectations of the family medicine? They put these new ones and they're studying them, and their new concepts will be coming soon. And as it's 2025, so it's coming soon. So I would strongly recommend to have a look at them, and also keep in mind do you have any experience with those? Can you do anything during this time that demonstrates what they are looking for? Like, for example, they have now indigenous health. So try to find any experience, or maybe educate yourself about indigenous health, take some courses. So they are looking for this, right? So you want also to show that you are aware of those somehow. So I put those here. They are for future, but I think it's a good idea to have a look at them and familiarize yourself with them, apart from the CANMED role 2015 ones. Next slide, Saida, please. This is the application for CaRMS. I took a screenshot for you. So to see, this is from my CaRMS application. The top part, it shows you how, like I took the screenshot. I just wanted you to see how much information they are asking for. There are tons of information you need to fill in. The application is really exhausting, and you will spend like you will spend like 2 months, 3 months maybe to complete it, because each part of those you have to be filling them very authentically. So just this is only the part, my information. Each tab has a section, but I just put my information. My information tab, it will open all of those for you: the profile, education, examination, experience. I want you to look at the experience part, because if you look at it, you will see work, scholarly activity. By scholarly activity, they're looking for teaching, research. They have the research, the volunteer, clinical experience, fellowship, publication, achievements, interests. So if you look at those, look how much effort you need to do. The reason why I told you keep a notebook about the CANMED roles, because if you have them, you can fill in your application easily, because you will be able to remember, yeah, I have them, I wrote them down, because it's all about the CANMED roles again. So please take some time early on and write them down, because you will find them handy during preparing for your application. The other thing I would like to say is also Nida touched on those, most of them, but the volunteering, the observership, work experience. To enhance your application, you can focus on your community involvement, research, health advocacy, teaching, volunteering. Recency is important. This is one of the factors that people emphasize very much on that. However, I know some people struggle to go back home to get their recency. There is an option, which is the licensed clinical assistant jobs. Please have a look on them. Internationally Educated Healthcare Professionals website. They have a dedicated part for the clinical assistant job with all the provinces. So please have a look at them. Some people would like to do those. Ontario has no licensed clinical assistant job, but as Nida also mentioned, that most people who has the licensed clinical assistant job, they consider that as recency in CaRMS, and they match. So if you have the ability to relocate, if you are in Ontario and you would like, you can relocate to other provinces like Alberta or Manitoba. For BC, they have the physician associate, the clinical associate, physician associate position. After I did not match last year, I applied for the physician associate, and it's straightforward application. They require recency, however. I can provide some information if somebody is interested in that. You just can text me, or I can provide my email, and I can provide more information about their application. The other thing I would like to mention about the Canadian references. Me personally, I had this CaRMS cycle, 3 reference letters, one from my back home from Syria, and the other 2 were from Canada. The second one was from a family physician where I worked as a clinical assistant in Ontario, which is not licensed, but it was good experience because I learned a lot about the Canadian healthcare system, the EMR. and the physician provided me with a reference letter where I worked with her. The second one was from a research supervisor. The third one was from a research supervisor here in Canada. So what happened at that time, I came from Syria and we don't have so much emphasis there on research. The only research experience I had there was my graduating thesis. So when I came to Canada, everybody was talking about the importance of research and you have to do research. Although I was interested in family medicine, who does not emphasize much on research, but I didn't want to keep it blank. So I took a research certificate, a clinical research certificate, and what I did is like I emailed, like I opened the website of Toronto University and searched all the scientists there. And I spent maybe 1 week just emailing all the scientists there. Of course, I was looking into their research. If there is something I was interested in, I spent maybe 1 week, like full time, just emailing the scientists. I received two feedback from two of them, scientists who were interested in taking me. I'm just volunteering. And I ended up with one of them. I worked with them on research online, and it was just reviewing literature and data collection. And they provided me with a reference letter, research reference letter, but it was faculty member, like University of Toronto. So I think it weighed well in my application, although it was research. Some people say research reference letter does not work, but it worked for me. So yeah. So Nida said like she did the same. Yes. Yes, for sure. So faculty members, even if research or observership, I also, yes, agree that they are very helpful. That is for this slide, Saida. So this is the interview. I think for the time's sake, I will go quickly over. This is the last slide. I would say interview, take it seriously. Take it seriously as NAC and QE1. Last year, I didn't have a chance to prepare well for my interview, and I think it was a factor that I didn't not match. So take the time, practice daily, like maybe even like if you're anticipating your QE1 and NAC scores are good and you're anticipating you're getting interview from Ontario, even you start while you're preparing for your CaRMS, that much I would say, because it weighs like around, some people say 40 to 50%. So it's almost half of the application. How exhaustive is the CaRMS application? It weighs as much as the interview. So you don't want to miss preparing for the interview, especially if you came from a place. For myself, I came from a place where I never had an interview in my life. So it was really hard for me to get used to the aspect of interview, how to answer them. And they are all about CAN-MED roles. You have to have your examples ready, produce them in a nice way. So please don't underestimate the interview and take your time. And the interview is all about the CAN-MED roles. If you have them in the back of your mind, you will be fine. But take it seriously. It is really important factor of your match. And that's for me. Thank you so much. If you have any questions, I'm ready to answer. And please, it is. I know it is a hard, not a straightforward process, but it is doable. Just reach out to people, ask questions if you have. And I'm sure like you don't know who you will meet that will change the whole thing. So just be positive about it. And I wish you all the best. And I am happy to help if you have any question.
With the matching of our mentors and mentees. So far on the call today, I'm just seeing where we have one individual for that mentor-mentee pair. So we will just go ahead for using the preferred method of contact to dialogue or liaise with those persons with regards to the matching, but we do have those pairs ready and waiting to go where that is concerned. Now, at this time, I would like to of course, extend our heartfelt gratitude to Nida and Randa for, of course, referencing those resources, very helpful resources, especially the free ones. I mean, we're quite cognizant of the financial vulnerability is real, for also not just presenting strategies for CaRMS, but also referencing medical licensure program for international medical graduate, such as that MLPIMG, BC-CAP, CanMeds roles, concerns relating to recency of practice, and how to increase those cultural competencies and show readiness, or how to shine. And also not forgetting to mention that there are moments when you will also find that you're in a low period mentally or psychologically. Based on those challenges that you're facing, it's not the end of the road, it's not the end of the game. Of course, I believe we can all concur that there were a lot of actionable strategies to help you shine going forward in this process. Without further ado, Saido, would you like to say something before we close off here? And also, before Saido come on, here you have a code, and this will be it's more like a survey, just getting some feedback from the Mentimeter.
Thank you very much, Dwight, and thank you everybody for your participation today. Thank you, Nida. Thank you, Randa, for your time and for sharing all your insights and experiences with all of us here. We really appreciate it. And we look forward to hearing your feedback. There is a survey that is posted on the chat box. Please feel free to use the survey and let us know how you felt about the webinar and what you would like to hear from us henceforth. And there is also a WhatsApp group that is focused on internationally educated health professionals. Please feel free to join them so that we can continue with the conversations.